One useful exercise in healthcare economics is to figure out who is the supplier and who is the demander in each relationship on this board. So let me do one of them, and then I'll have you pause the video and try to figure out for yourself who's the supplier and who's the demander, and then I'll explain. Okay, in the patient-insurer relationship, the patient is the demander and the insurer is the supplier. Now I'd like you to do the same thing for each of these before I explain. Alright, now here's a hint when you're thinking about who's the supplier and who's the demander. Usually if one party is paying another party money, they're paying them for their services, for their goods or services. And so usually if you think about a classic supplier and demander, like you going to the grocery store, you pay the grocery store money for your food, you are the demander, they are the supplier, they're supplying you with groceries. So if you think about money exchanging hands, that's going to go from the demander to the supplier, and that will help you figure out these relationships. So here we have patients, of course, are always going to be the demanders. They're not supplying services. They demand insurance. They pay for their insurance. When they go to the doctor, they pay the doctor for the doctor's services, and same thing with hospitals. The one relationship that sometimes students get wrong is the relationship between insurers and doctors. The insurer is paying the doctors to provide services for the insurer's customers. So the doctors supply services for the insurers as part of the insurer's product. So in this relationship, the insurers are the demanders, the doctors are the suppliers. And that's also true of the relationship between insurers and hospitals. Insurers are selling a product to their patients, and part of that product, one of the inputs, is hospital services. So the insurers are purchasing hospital services for their customers. The insurers are the demanders, the ones purchasing those by handing money to the hospitals. The hospitals are the suppliers of those services. And, I'm gonna not put one there. And the government, now this of course depends on the setup of the government's healthcare system, but if the government is buying insurance, for example, as a single payer, well actually not as a single payer, I have another video on that, but usually the government is going to be demanding services for the population, and in which case most relationships here the government will be the demander. Now the only more complicated relationship up here is doctors and hospitals. Who's the supplier and who's the demander? Well, it actually depends. In some cases, hospitals hire doctors either as consultants or hire them directly, in which case, in that situation, the hospital would be paying the doctor for the doctor's services, so then the hospital is the demander and the doctor is the supplier. However, doctors also need hospitals to send their patients to. So doctors can also be the demanders of hospital services, and the hospitals supply those services for the doctor's patients. So this relationship is not always straightforward, and it depends on the context. But this is just an overview of generally supply and demand in the healthcare industry.